Aloha guys, Dr. Thomas coming back at you. Today we're going to talk about the respiratory system. Very important. Okay, there's the upper respiratory tract and the lower respiratory tract. Now, here it just says inside the chest and outside. So to make sure I looked it up. And actually the vocal cords are the cutoff. The vocal cords and above are upper respiratory, and below the vocal cords are lower respiratory tract. So this is about inside and outside the chest. I mean, what's meant by that? The thoracic cavity, but they don't say that. Okay. Upper respiratory tract. Organs includes the nasal cavity, the pharynx, which is the back of the throat, the larynx, and the upper trachea, the tube you breathe through. So here's the nasal cavity, the pharynx. The larynx is actually the voice box that we speak through. The trachea. Here's our two lungs. So the vocal folds, or the vocal cords, are the cutoff between the two. Lower respiratory tract includes the lower trachea, the bronchi, the bronchioles, little tiny ones, alveoli, which we'll talk about in a moment, the membranes of it, and the muscles. Upper respiratory infections are the #1 reason that people seek medical care, unless something's changed. It used to be. Okay. Let me adjust this just a little bit. Okay, nasal cavities, pharynx, back of the throat, the larynx. There's 3 pharynxes. There's nasopharynx, oropharynx, and laryngopharynx. The larynx are the vocal cords. Remember, this is the cutoff between upper and lower. Here's our thyroid cartilage, the Adam's apple in men that you can see. And here's the trachea, the tube that we breathe through. These little cartilaginous rings, guys, keep it from collapsing when we breathe in. Otherwise, the vacuum would go. It's like on a vacuum cleaner hose. How it's got those rings. Same thing. Functions of upper respiratory tract. Nose and nasal passage warm, moisturize, conduct, and condition air. The pharynx is the throat, conducts air to the lower structures. Larynx is the voice box. Vibrates. Vocal cords produces sound. Trachea is the windpipe that we breathe through. Conducts air to the right and left bronchus, or bronchi. Okay, lower respiratory tract is the lower trachea, the bronchi. The bronchi branch out into little tiny ones called the bronchioles. Then we have air sacs that we exchange the gas through, and those are called alveoli. You see that here. Then there are membranes and muscles also. Okay, there are 2 lungs. Large, soft, cone-shaped organs contain structure of lower respiratory tract. The apex is at the top. The base is at the bottom. The lungs, guys, sit on top of the diaphragm muscle. And so they have like an indented portion for that. Okay, the right lung has 3 lobes. Again, this is the patient's right and not our right. And the left lung has 2 lobes. Superior, middle, and inferior. And the left lung is just superior and inferior. Okay, there are little air sacs. In the drawings, they always look like little sacks of grapes, called alveoli. When I was in school, I can recall, it seemed like they said there was about 1 million in each lung. I just Googled to see, because science learns as it goes, and it's always changing and all. Now they're saying there's 600 million alveoli between the 2 lungs. 600 million. Now this, guys, is where gas exchange takes place. This is where oxygen, carbon dioxide, here in these capillary beds that are right up against the alveoli, is where all this exchange takes place. Very important. By having so many, it's 600 million, it gives you an enormous surface area. Said the size of a tennis court, but I've also heard the size of a football field. The more surface area you got, guys, the more gas that can be exchanged. So all this is vital to life. Okay, the membranes, the serous membranes of the respiratory system are called pleura. There's parietal pleura that lines the cavity, and there's visceral pleura that lines or is on top of the lungs. Anytime you see the word visceral, it means the organs. That's how you can tell the difference. Parietal's the cavity-lined, visceral pleural, the membrane that wraps around the lungs. And there's a little space, there's a little fluid in there to keep it lubricated, called the intrapleural space. Here's the diaphragm muscle, the major muscle of breathing. Bronchial tree, okay, so here's the trachea. It bifurcates at what's called the carina, right here, into the right and left primary bronchus. Notice that the right is further down. This one goes off more of an angle. What does that mean? When people swallow things accidentally, particularly children, it's more apt to go down the right into the right lung than the left because it's a more direct path. Alveoli, we already talked about, look like grapes, 600 million between the two. Bronchial tree, there are the primary bronchi, right and left, cartilaginous rings, carina where the trachea bifurcates. Right bronchus short and wide, I already said that. Secondary bronchi, tertiary bronchi, and then it becomes bronchioles. They get smaller and smaller and smaller, and the bronchioles, like right here, the tertiary bronchioles, are what attach to the alveoli. Of course, alveoli have a single squamous cell, so that gaseous exchange can take place easily. Bronchial tree functions. Bronchi conduct air to the bronchioles. Yeah, they're similar to the blood vessels, guys. You know, the aorta is a big, huge artery, and as it goes through the body, it branches out, and eventually you have little tiny arterioles. It's the same thing with this. You have the big bronchial tubes, the primary, and then and eventually you have the little bronchi, bronchial tubes, and all also have a layer of smooth muscle, so they can dilate and constrict on command. Also, the little tiniest ones don't, but the larger ones do. Alveoli, small grape-like structures, air sacs exchange oxygen and carbon dioxide with blood in the pulmonary circulation. How many of them are there? 600 million, according to where I Googled. O2 moves from the alveoli into the pulmonary capillaries. CO2 moves from the pulmonary capillaries into the alveoli, and when we exhale it. Okay? What makes it do that is passive diffusion based on pressure, concentration gradients, like you studied in chemistry. Factors in lung expansion, let's see. Okay. Normal lung expansion depends on opposing forces. One factor promotes lung expansion, negative intrapleural pressure. Two factors oppose lung expansion, elastic recoil, and surface tension. All right. Now, here's what they're saying, guys. Think of the lungs as two balloons inflated in an airtight container. Because that's very similar to what's going on. What they're talking about, elastic recoil is the tissue, and surface tension, we'll get to that here in a minute. So the thoracic cavity is airtight, and it has a lower pressure than the surrounding atmosphere. Negative intrapleural pressure allows the lung to expand. It overcomes elastic recoil and surface tension. P1 atmospheric pressure, P2 intrapulmonic pressure, P3 intrapleural pressure. So not only is there pressure in the lungs, but there's a pressure in the membranes, the visceral pleura. Here's a collapsed lung that's been deflated. Remember, think of the lungs as two balloons inside an airtight container. Here's the diaphragm. Elastic recoil, lung and balloon want to return to unstretched shape. Okay, that's a good comparison. Result of arrangement of fibers, elastic tissue, and lung. Guess if it didn't do that, it would inflate and it would just hang there. I mean, we have to have it return back. And this elasticity in there is what does it. Just like a balloon. You let it out, it's going to... As tension is released, the elastic tissue will recoil, and return to its unstretched position. Okay. Now, surface tension. Water, for example, has a high surface tension. It's because of hydrogen bonding. That's why if you pour a little water out on a table, it makes bubbles, you know, like water molecules pulling on one of them make the alveoli, or alveolus, which is singular, smaller. But there's a chemical called surfactant. Now, I was always taught that it was surfactant, but here they say surfactants, like there's more than one. I'm not saying they're wrong, guys, but considering that the course I had was in a lot more depth, I would think that that was correct. But okay, we have this surfactant that diminishes the surface tension of the lungs. It makes it easier to inflate. Premature infants often don't have surfactant developed yet, and that's why they have problems with breathing. So what does surfactant do? Diminishes surface tension, makes the lungs inflate more easily. Collapsed lung. All right, here's the thing. Remember what I said. The lungs are like two balloons in an airtight container. What if that airtight container gets a hole in it? Then the atmospheric pressure comes in and it collapses the lung. That's what they're showing here. Or in this case, what are they doing here? They're pumping out the air to make it reinflate. Okay. But they didn't show how it collapsed in the first place. Okay, now they are. For example, a knife wound. Anytime you get air in the chest the chest cavity, it's called pneumothorax. Now the P is silent. Pneumothorax. You can also get a pneumothorax from a gunshot wound or from a cancerous tumor or an infection that eats through and eats a hole to the outside world. And when that pressure comes in, whoosh, it collapses the lung. You have to seal up the hole, and then you can get it to hopefully can get it to reinflate. 3 steps in respiration. Inhalation or inspiration, exhalation or expiration. Respiratory cycles, 1 inhalation, 1 exhalation. Exchange of oxygen and carbon dioxide at the lungs and the alveoli and at the tissue level where it's going in and out. And of course, the blood is what transports those gases. Boyle's law, let's see. Sorry, guys, I've got to get this. I've gotten it out of it. Okay, all right. Pressure and volume. In other words, the greater the volume, the lower the internal pressure. The lower the volume, the greater the internal pressure. So in other words, you got a lot more volume here than you do here. The reason this is firm and taut is because there's the same amount of gas in a smaller space. Larger inner tube volume, smaller inner tube. Add a liter of air to each, small tube gets pressure more. The greater the volume, the lower the internal pressure. The lower the volume, the greater the internal pressure. Okay. That's called Boyle's law. That's actually a famous. Boyle's law of inhalation. Respiratory muscles, which are the intercostals and the diaphragm. I wish they wouldn't say it in that order because the diaphragm is infinitely more important than the intercostal muscles. Infinitely more. Contract to increase the thoracic volume. As the internal pressure decreases, the intrathoracic pressure increases. Air moves into P1. So here's what they're saying, guys. I wish they would explain it like I'm getting ready to explain it. When you take a breath, the diaphragm contracts and it moves down. That opens up. That creates a vacuum and stretch, and it pulls and draws the air in. So by increasing the volume, it sucks the air in. Then when you exhale, unless you're trying to blow out a birthday cake candle, when you're doing passive exhale, you just relax and the elastic tissue blows it back out again. Normal exhalation is a passive process. Respiratory muscles, diaphragm. They're making it, by talking about P1, P2, and all that stuff, guys, all that is legitimate, but they're making it more difficult than it needs to be when you're first trying to learn this stuff, okay? Diaphragm relaxes, everything goes back, and it blows the air back out again. Respiratory muscles, well, here they've got diaphragm. Maybe I'm overly picky, guys. I don't know. The diaphragm is by far the most important of the respiratory muscles. Infinitely more than the rest. Okay, innervated by the phrenic nerve, intercostal muscles innervated by intercostal nerves. Okay. Respiratory muscles are skeletal muscles. The neurotransmitter is acetylcholine. Blocking the receptors impairs ventilation. Curare. Okay, I think it's a little early to get into that, but gas exchange lungs. What's supposed to be here? O2 moves into blood from the alveoli. CO2 moves into alveoli from the blood. Well, we're running out of time, guys. We'll continue on with the next one. Dr. Tom out of here.